Are you in dentistry working on patients all day in the operatory? This job can be stressful in more ways than one. It's tough on the body, plus it can be a mental and emotionally challenging job as well. Did you know that dental clinicians, whether they be a dentist, hygienist, or assistant, experience pain upwards of 90%? That's way too high. Stress and burnout are also common, especially since COVID. We have power over this as well, and today I'm going to show you some tips to not only take care of your body and the operatory, but your mind and your stress too. Hi, my name is Stephanie from Polished Posture, and here we talk about ways to be more ergonomic both in the operatory and in front of your computer. Today is for my dental workers. We're going to talk about clinician positioning, how to adjust your stool, and some options for standing dentistry. How often are you sitting on your stool? Hours a day, right? If you have a stool that doesn't fit you or that isn't adjusted correctly, this can add up over time. Just imagine you were walking around in a pair of pants that didn't fit, especially pants that were too tight. Yeah, I've been there. Not comfy. Think of your stool the same way. Whether you're sitting on the stool for a couple minutes or for hours, you want to make sure that it fits you. Here's what you don't want to do. Sit on your stool too low with a 90-degree angle between your torso and your thighs, meaning your thighs are parallel to the floor. This puts pressure on the hips and the low back, not to mention your legs are jutting out in front of you, which makes it hard to get close to the patient chair. What you do want to do, raise your stool up pretty much as high as you can so that your hips are above your knees. Do you see how my thighs are sloping down towards the floor and how open the hip angle is? This is much kinder to the hips, much kinder to the low back, and it gets your legs out of the way so you can scoot up much closer to your patient. You'll see I'm on a saddle stool here. I do recommend these for most dental clinicians. If you're a dental clinician and you know that you already have something called lordosis, which is excessive inner curvature of the lower spine, a saddle stool might not feel great for you. But for most of us, it's a great option. Saddle stools are like a pair of pants. The one that fits me likely won't fit you. It's very individualized. I recommend that you go with a well-known, reputable company, talk to a knowledgeable rep, give them your stats as far as your height, torso, hip width, any existing body issues, and they'll be able to point you in the right direction. Do your research, and I'm here to help you as well. What about standing? Standing can be a great addition to how you practice in the operatory. I recommend trying to stand 30 to 50% of your day. Why? When you're standing, you're using different muscles than you're sitting, so you're not overworking the sitting muscles all day long. Plus, the act of sitting and standing promotes really good blood flow. Blood is good for our muscles. And when you're standing, your legs aren't in the way, so you can get much closer to your patient. I recommend standing, especially if you have patients that cannot lean back in the chair, are full-bodied, or are pregnant. Don't overthink it though. All you do if you decide you want to stand is vertically raise the level of the patient chair. You don't have to mess with the incline or decline of the back of the patient chair, and you don't have to worry about adjusting the headrest. Just make sure that the level of their mouth is still at the level of your elbow. If you don't know about my elbow rule, please check the video that's linked down below on neutral posture. Now let's talk about taking care of our mental stress. Something that can really help regulate stress is our breathing. Diaphragmatic or deep belly breathing has been shown to lower our pain perception, so the amount of pain that we feel, and our stress. The good news is you can do this right in the operatory with your patient. They don't even need to know that you're doing a breathing exercise. There are many ways to practice deep breathing. Today, I'm going to focus on a very simple variation of something called box breathing. This is so easy to remember and to do, but when you're breathing, make sure that you're taking breaths in through your nose and you're imagining them getting sent down into your belly. So you want to feel your belly push out a little bit. When you exhale, do it slowly through your mouth. So you're going to inhale slowly through your nose for 4 counts, hold your breath for 4 counts, long, slow exhale for 8. That's what's going to lower your stress response. Hold your breath for 4 counts and repeat it. Inhale for 4, hold it for 4, exhale for 8, hold it for 4. If you do a few sets of this is going to help you lower your stress, lower your pain, and feel much better in the operatory. What you don't want to do is take small little sips of air either through your nose or your mouth, but into your chest. That actually activates your sympathetic nervous system and it tightens up all these muscles here, which we don't want. So if you don't know how you breathe, just put one hand on your chest, one hand on your belly, just take a few natural breaths and see what hand moves. For most of us, it's going to be our chest. So that's something to work on. Just keep focusing on taking deep breaths in through your nose and using your belly. Seeing patients working in dentistry can be tough, both physically physically and mentally, but there are so many things we can do to make it better and help ourselves feel better. Don't forget to subscribe to this channel for more tips on practicing ergonomically in the op.